All right. Depression. Sadness touches all our lives at different points, however, depression is different. It can have a staying power and great depth in people's lives, and it's more than a feeling of down or a passing bout of sadness. It can cause feelings of continuous burden, or take the happiness out of a lot of activities that people may have enjoyed before. So what is depression? Depression is a mental illness which affects the way a person thinks and acts. There's lots of symptoms, which include loss of interest in daily activities, fatigue, feeling of worthlessness, indecisiveness, insomnia or hypersomnia, restlessness, anger, irritability, self-loathing, reckless behavior, thoughts of suicide, and more. Some statistics. Depression is listed as the leading cause of disability in the United States, with over $40 billion being spent on lost work, lost productivity, and medical treatment related to the illness each year. 9.5% of the adult population living in the U.S. are affected by depression, and around 17.5% of people living in the U.S. will have a depressive episode during their lifetime. And depression is most commonly treated pharmaceutically or with psychotherapy, but national estimates show that only 23% of those with this illness seek treatment, and only 10% are receiving adequate treatment. Some of the methods of assessment that we saw in our paper, there were a good amount. The two most common were the HRSD, Hamilton Rating Scale for Depression, and the BDI, Beck Depression Inventory. It's a questionnaire. Most of the assessments to diagnose depression or assess depression are questionnaires. There's not a way to scan it or test for it. But the HRSD is a 17 questions about symptoms of depression, depressed mood, guilt, insomnia. A 0 to 4 scale, 0 being no symptoms and 4 being severe symptoms, for 8 questions. And 0 to 2 for 9 questions. The higher the total score, the more severe the depression is. And the BDI is really similar to that and the other ones as well. But the HRSD and the BDI were the most common that we've found.
So first off, we want to look at what influences like how to prevent depression, because instead of just looking at treating depression after the fact is already there, just as Ben Franklin says, an ounce of prevention is worth a pound of cure. We want to see the effects of exercise on depression. So data from the ACLS, that's the Aerobic Center Longitudinal Study. So by using this CESD as assessment, it wasn't as common as many of the others, but it is a valid assessment. So they found that there's a negative correlation between the cardiorespiratory fitness scores between males and females and the average depression score that would be expected. And so this used thousands of adults. It's not a truly representative population because it's those who went to a specific hospital rather than a randomized selection of adults. But with a sample this large, it does show a very good trend. So this first bar, the darkest bar, is the lowest 20% of the fitness category. And then there's the next 40% and the top 40%. So the more fit an individual was, the lower they were likely to score on depression. And I've noted here that a score of 15 qualifies as having mild depression with the CESD. So just here with women who are in the lowest fitness category, this is just the average. So if you think there might be some who are a little bit higher and some who are a little bit lower, that's a significant number in the low fitness category that would classify as being depressed. So it's important to find methods of preventing depression, and the symptoms that would progress toward depression, and exercise is a valid one. because aerobic exercise is well established to improve cardiorespiratory fitness through regular performance. So it would be hard to say exactly what intensity and frequency, because any number of combinations can have improvements. This is just the generalized idea of it. So another study, this one it's not nearly as strong of support, but needed to have more than one study, because there were only 2 studies out of all like 30 or 40 that we found that mentioned exercise and how it could be utilized in preventing depression. So this one was gathered through different states using, let's see, PRAMS, a pregnancy risk assessment, something's scale. I didn't write it up here, but this applies just to women who were in the last trimester of their pregnancy, and those who exercised 5 days or more for 30 minutes a day or more during their last trimester. Actually, I should say it the other way. So those who are sedentary, meaning less than 30 minutes of exercise within a whole week, compared to those who did exercise 5 or more days a week at 30 minutes, had a 1.34 times more likely or greater odds of screening for depression. So I can say depression rather than postpartum depression, because postpartum depression is defined as major depressive disorder, or just depression that is seen to set in within the first several months after giving birth. So more research is needed to be more definitive in the statements as far as the effects of exercise in preventing depression, but there certainly is a good trend with the previous study, with aerobics and a longitudinal study.
Okay, so mode. What type of exercise is best in decreasing depression symptoms? So we found 3 studies that compared aerobic versus anaerobic. One of those studies was done by Martinson. It had 90 participants, and 43% or 43 of those participants did aerobic, which was like a brisk walk or jog, and then 47 did muscle strengthening. And they did this for 1 hour, 5 days a week, for 8 weeks. And what they found is that both aerobic and anaerobic exercise lowered depressive symptoms, as well as there was no difference between aerobic and anaerobic. And then we wondered like if combined would be better or not. So we found one that combined them. It was done by Mather, and they had 86 participants. It was done on like elderly 53 and up, and so they just did a class that included endurance, muscle training, and flexibility. This class lasted for 45 minutes, 2 days a week, for 10 weeks, and it showed that on the Hamilton Rating Scale of Depression, from baseline of 16.7, it decreased to 12.6 at 12 weeks. And so we couldn't find a study that compared like a combination and aerobic, and like versus aerobic and an anaerobic. So what we found is just that there's no significant difference between aerobic and anaerobic, and that a combination of both also shows decreases in depression scores.
Okay, now we're going to talk a bit about intensity. So there were quite a few different ways that the different studies we found measured intensity. Some of them use percent VO2 max, others use percent heart rate max. Another used METs, and one used kcal per kilogram per week, and then the resistance training ones use percent 1 repetition max. Through our studies, we found that moderate exercise is effective in lowering depression on the HRSD, but that high intensity exercise lowers depression more than We also found that low intensity anaerobic exercise, resistance training, doesn't lower depressive scores as much as high intensity anaerobic exercise. We looked at we compared high versus moderate intensity for aerobic exercise. The first study we looked at was by Doyne et al. And it was at high intensity, 80% of max heart rate, and they were running. It was 3 days a week for 8 weeks, and there was a significant difference from the pre-HRSD, Hamilton Rating Scale for Depression, and the 1 month post-exercise. The mean change was 9.9. You can see it, I circled the pre part on that top diagram there, and then the 1 month after the exercise, that there was significant increase in depressive scores. And the other study we looked at was looking at moderate intensity aerobic exercise, and it was done by Moda Ferreira, and the participants exercised at a moderate intensity, which was between 3.7 and 4 METs, or walking, and their HRSD scores also decreased by 6.84 on the mean, and actually the control group actually became more depressed. It's definitely better to exercise on that one. And I also circled the changes there. Next, we looked at high versus low intensity in resistance training. The first study we looked at was by Singh et al. I really like Singh et al. He's a man. Really good stuff. He was looking at low intensity resistance training compared to high intensity, and the high intensity was 80% of 1 repetition max, and the low intensity was 20% of 1 repetition max. And they did 8 weeks, 3 times a week, and they did 3 sets of 8 reps on all major muscle groups. So like, I believe there's like 4 or 5 different exercises, chest press, and some leg exercises were also included. And what he found was that high intensity resistance exercise lowered HRSD scores by 50%, and the low intensity lowered it by 29%. And you can see the values up there. For the high intensity, it was 18 plus or minus 4.5, and then post it was 8.5 plus or minus 5.5, and then for the low it was 19.5 plus or minus 5.3, and then after it was 12.4 plus or minus 6.3. So low it still helped a little bit. I just wanted to illustrate that high helped a lot more. And then another study by Singh, he did, I think this one he actually did before the second one, and he was just looking at the effect of high intensity anaerobic exercise, and this was done on older adults. And this one was looking at the Beck depression inventory, and it also showed that those who exercised anaerobically decreased scores on the Beck depression inventory, except for the one outlier. That guy dropped out of the study. It wasn't cool. So they just threw his data out, and it was significant negative correlation.
That was resistance training?
Yes, that was resistance training, progressive resistance exercise.
It's frozen.
We have all our slides memorized, so don't worry.
Okay, there.
Oh.
Did I go too far?
No.
Okay, just checking.
All right, so how long should each exercise session be in order to achieve the best antidepressant effects? was a study by Dimio et al. They assessed benefits from aerobic exercise in patients with major depression. The exercise program consisted of walking on the treadmill for 30 minutes each day for 10 days. They used the Borg rate of perceived exertion and exercise at a somewhat hard intensity, which is between 13 and 14, 6 being very light and 20 being very, very hard. So the results showed 5 patients received a score of 10 or less on the HRSD, and all the patients' scores reduced significantly from the beginning to the end of the training program, p-value of 0.002. And resistance exercise duration. Singh et al. Found that 45 minutes of progressive resistance exercise significantly lowered HRSD. Progressive resistance exercise is it's an exercise program that builds physical strength by lifting progressively heavier weights. They took 32 patients between 60 and 84 years old, so it's an older population, with mild to moderate depression. They were assigned to either a control group. It's an attention control group, so every time that the other group exercised, the control group went to kind of an attention group, like talked it out, I guess. But the group, the supervised progressive resistance exercise program, they did it for 3 times a week, 45 minutes. Depression scores from the PRE program went from 12.3 plus or minus 0.9 before the program to 5.3 plus or minus 1.3 after the program. The scores of the control group without the exercise went from 11.4 plus or minus 1 to 8.9 plus or minus 1.3. So the social interaction was, we can assume that it was a factor in the control group that lowered their scores a little bit. Summary, exercise duration. As little as 30 minutes of aerobic exercise a day has been found sufficient to lower depressive symptoms. There were 4 studies that back that up, and 45 minutes of resistance training has also been found to be effective in lowering depressive symptoms, and 3 studies found that. Unfortunately, we weren't able to find any studies that compared duration, so of 10 minutes, 20 minutes, 30 minutes. This was all that we were able to find. So although there was no studies that compared different durations to measure antidepressant effects, there's not enough research in order to know if duration is a significant independent factor in decreasing depressive symptoms.
All right, and then frequency for aerobic training. The frequencies kind of varied, so I'm going to talk about a few of the different frequencies. One study measured 2 days a week. Well, actually we had 2 that did 2 days a week, but one of them was done by Stein. He had 89 participants, and they did swimming for 90 minutes, 2 days a week for 7 weeks. And they found that this significantly lowered scores on the Beck Depression Inventory by 3.71 from baseline. And then there was a couple studies, 3, that did every day, and they just had the people walk every day. This was done by Al Isa, and there were 76 participants, and how they measured how many steps they walked were they had a pedometer, and they found that depression scores improved from about 9 to about 4, and that was significant. And then we had 8 studies that did 3 days a week, and 3 that did 5 days a week. And so I wanted to compare kind of the differences, and we found one study that did 3 days versus 5 days. This was by Dunn, and they had 80 participants. And so they exercised 3 or 5 days a week for 12 weeks. And you can see they separated them into 5 different groups. There's a low dose for 3 days, a low dose for 5 days, and then that's public health dose for 5 days, or 3
Explain those.
days. So what the public health dose, okay, so the low dose was 7 kcals per kilogram per week, and then the public health dose was 17.5 kcals per kilogram per week, and they,
kcals per kilogram body weight
Yes.
yeah,
per week.
per week.
So they have to
Burn it.
burn total
Yes,
Yeah.
so this is the overall volume of
Mhm.
exercise
7 calories is all?
per kilogram, yeah, per week. That's a low dose.
Right.
It's
Okay.
K-count.
So the low dose was 7.
Yeah,
Okay. What was the public health dose?
17.5.
Okay. Okay.
And then control, they just did like stretching and stuff. So you can see that there was a significant difference from those in the public health dose, and then like the low dose 3 days. But relating to frequency, there was no significant difference between frequencies. And then for anaerobic training, they mostly did 2 days a week or 3 days a week, and we found 3 studies on each. So this one, I just talked about in aerobic. They did both resistance and aerobic, but instead of swimming, they did like a weightlifting. And their scores decreased by 3.8 from baseline. And then for the 3 days a week, this was done by Singh. There's 32 participants, 45 minutes, 3 days a week for 10 weeks. And they found that the scores on the back depression lowered from 21.3 to 9.8 in the exercise group. And in the control group, it was 18.4 to 13.8. And you can see, like, it says time p-value. That is, that shows that both of the groups significantly decreased their depression scores throughout time. And then the group times time shows that there was a difference between the 2 groups. So the exercise decreased more than the control group did. Okay, so to summarize that, it shows that aerobic and anaerobic exercise 2 or 3 days a week shows significant difference. And for anaerobic, 5 days is not no better than 3.
Okay, so this graph right here might require just a little bit of explanation because I couldn't figure out how to have it as a yes or a no, so I just had to leave the values as a 1 or 0. So this is the data comparing the effects of antidepressants to the effects of exercise alone or a combination of exercise and antidepressants, because antidepressants do cost money. You have to go through a medical professional, and it takes time to get the whole process worked through. So we wanted to look, okay, so with exercise, you may, if you're low on health and like health risk factors, you may have to go through a health professional, but a little less involved there. So there are 8 studies that we found that looked over the effects of medication. So there's medication, there's exercise, and a combination of exercise and medications. And the yellow bar is where they found that there wasn't any significant difference between the exercise and the medications or the combination. But not every study analyzed each of the combinations. 5 of the studies,
So which is yes, which is no, 1 or 0? Which
1 is yes.
One is yes.
So that means that that treatment was found to have superior results, although the other treatments did also have significant improvements. This is just showing which one was superior. So 5 of the 8 studies show, well, actually I should say 5 of the 6 studies which analyzed a combination of exercise and medication found that the combination was superior to medication alone or to exercise when that was also included. So we can say, not absolutely definitively, because we would like to have more data, but from what we have here, it seems to suggest that a combination of medication and exercise does provide better results than either exercise or medication alone. And in no instance was exercise or medication shown to be superior over one another. So they have relatively equal effects as far as the studies that were performed that had equal time intervals and varying on the study just what they did in that time frame. So a combination of exercise and medication at least was no worse than medication or exercise alone, but there is a potential that it is better, that it provides greater results beyond either one alone. So also, going along with exercise and depression, exercise versus antidepressants is most health professionals won't prescribe medications unless there's either the depression has been around for at least 2 to 3 months, or there's been a past history of depression. So during that time period, the depression isn't being treated. So exercise is something that you could begin immediately as soon as you recognize depressive symptoms without having to wait during that period for the health professional to see, okay, is it going to go away on its own, or are we going to have to wait until we know it's a real issue? Furthermore, medications commonly require several weeks before they show significant effects. Just a quick search on Google, I got 3 or 4 different sites. It said some were like 2 to 6, some were 1 to 3. There's a range depending on the medication because there's a large number of different medications that are available, in addition to several studies which referenced other studies which included that data. So small improvements can be seen in depression symptoms through one bout of exercise. We found only one study out of all of ours that made mention of that, so it wasn't enough to really base off of.
Say that again? That last statement?
That one bout of exercise can produce a slight difference in depression scores, a slight reduction, not just a difference, but reduction in depression scores. Obviously it can vary between person to person, but it is important to note that the effects of exercise can be immediate, acute. More research would need to be found to know the duration of those acute effects of exercise on depression. But as we've already gone through, as we've already discussed in previous information, the chronic effects of exercise are significant.
Okay, so in conclusion, just going to kind of summarize what we already talked about. So for intensity, they need to exercise preferably at a high intensity for anaerobic exercise at 8% of one repetition max for at least 45 minutes, and that would show a decrease in depressive scores. And for aerobic exercise, it would be 80% of heart rate max, 3 days a week for at least 30 minutes, and that has also been found to lower depressive symptoms scores on those scales. Mode, there is no significant difference between performing aerobic or anaerobic exercise. Both of them have been found to lower depressive symptoms, and combination of both also shows decreases in depression scores, but we weren't able to find anything that compared a combination of both to just resistance training or just aerobic training. For frequency, we found that aerobic exercise should be 2 to 3 days a week, and that exercising aerobically more than 3 days a week is not significantly different from exercising 3 or more days a week. And 2 or 3 days of anaerobic exercise will also help lower depression. exercise with antidepressants, we found that exercise is nearly as effective as antidepressants, and aerobic exercise is no worse than aerobic exercise in combination with antidepressants is no worse at treating depression than antidepressants alone, but it can provide additional health benefits. And then we were just looking at a few ways that why exercise can work in treating depression, and we found that endorphins, that runner's high you get after you exercise, makes you feel good. That may have an effect, but we have to look at some more studies to see if that was significant or not. We just kind of did this to show why it may be happening. Also, neurotransmitters such as serotonin, dopamine, and norepinephrine, their levels increase in plasma and urine, so that may help also lower depression. But the study I looked at didn't say if it actually increased levels in the brain or not, so we have to look at another study and find out if that was true or not. Distraction serves to distract us from the stresses of life, which says long PowerPoint presentations. Just help you forget about all your problems, go exercise and feel better about yourself. And then self-efficacy. It's believed that self-efficacy may be linked to exercise and having greater self-efficacy, which is having confidence that you can fulfill your goals and actually see results from working towards them. Depression makes it so we can't feel that very well, but exercise may help to increase self-efficacy so we can feel happier and have a better life. But also more research is needed to support that. Social support, we talked about before how group exercise helps lower depression scores, and I think it was a study Michael talked about, and also in this Mather study. So having exercise in the group section is another way to help lower depression scores.
Are there any questions?
Go back to